Hello, everyone. I am Isabella Brambilla, coordinator of EPAG, European Patient Advocacy Group in EpiCare, and president of Dravet Italia Onlus. What is EpiCare? As you know, EpiCare is one of ERN, the European Network for Rare Disease, specialized in rare and complex epilepsies. The goal of the activity, the EpiCare, is create a significant added value to the patients in terms of care, research, educational, and training. And this is this goal in straight collaboration with patient organization and scientific society. This is the core of activity in all ERN and specialize in our EpiCare group. In fact, as a patient, we are involved in several working groups that is part of the EpiCare structure that following different activity and different projects. But what do the EPAG do in a practical way? Ensure that the needs of patients living with rare and complex epilepsies will include it in each working group. Understand the difference between the different patient pathway, but also the similarity, because if for a medical point of view, every disease is sure different. As patients, we have common needs in terms of care of our patients. Also, the cognitive behavioral problem or the comorbidities decline really a lot of similitude between the different disease. Working with a national and European level is also very, very important, and also the main important goal is working in partnership with the clinician, the researcher, and support all activity that need to be done and take care also the patient perspective or the facilitation for access of these tools to the patients. But as you know, we have more than 130 rare and complex epilepsies conditions, and we wish to connect more associations and help us in making every voice harder. But for this reason, we need the support of all associations or family group dedicated on the single disease. And you see in the picture how many areas we need to cover with our network. I want to show you very short the timeline view of the activity in EpiCare, but in all ERN. We have the first period of ERN, the 5 years. We try to create a network and working together with some project and with the dissemination and the activity of working group. In particular, we started to working together with a patient journey to discover the disease and evolution in time in the different period of the disease, and also the leaflet to try to simplify in simple information dedicated for pediatrician or not expert clinician that need to have an overview very quickly about the single point, the single different for the different disease. And then we work for these 18 months to try to achieve 15 patient journey and leaflet for the different disease and translating also in the different language. A new proposal for the next step of ERN for the next 4 years is really to request a budget for the patient initiative and working together with a working group dedicated to the patient empowerment. For this reason, this year we want to dedicate our activity to all associations in Europe and all members of the single specific disease to give them the opportunity to make a presentation in the specific area of rare and complex epilepsies and have the opportunity to present themselves with a short video or a short presentation to know very well each other. We know that we have less time, but it's very very important if you can send your video to share not only internal of EPAG community and patient community, but also important that know the physician, where are the patient community and how they grow up in terms of collaboration and network with the EPAG member. For this reason, we want to grow up as community because we are some representative for the different countries, but sure also with the future collaboration with International Bureau for Epilepsy and the other association, we want to reach out more patient representative to be sure that every voice is included in our activity. At the moment, we have more than 150 European association contact in our newsletter. We will start to send a newsletter every month with to reach out to the community and to communicate the major important information for the activity and also for the single association or federation in Europe. For this reason, I will ask really to get to know the association, send us your video and your presentation with the main goal and main topic of your priority for your association, and share, please, our EPAG community. We are looking forward to hearing you and disseminating your information. Thank you very much.